Before the sun rises in Michigan, before coffee is poured and the world fully wakes, the doors of the clinic are already opening, and inside, Lindsey is ready. Not for fame, not for recognition, but for whoever walks through that door next. In urgent care, nothing is predictable. It could be a simple cold, a child struggling to breathe, a worried mother, or a man with chest pain hoping it's nothing serious. And when fear fills the room, Lindsey steps forward, calm, focused, unshaken. She listens, not just to lungs, but to people. Because medicine is not only about symptoms, it's about trust. For years, Lindsey has stood on the front lines of care, from coughs and fevers, to breathing emergencies, to chest pain that cannot wait. Urgent care is where seconds matter, and she knows exactly what to do. But Lindsey's story didn't begin here, it began in New York. In the Bronx, where the lights never dim and the pressure never stops, she trained to become a physician assistant. PA school in New York is not for the faint of heart. Long nights, intense rotations, high expectations, only the best survive. And she did more than survive, she excelled. Because if you can learn medicine in New York, you can practice it anywhere. Before urgent care, there was surgery. General surgery, where precision matters, where steady hands save outcomes, where the scalpel demands respect. Lindsey learned to suture with confidence, to perform procedures with skill, to remain steady when others felt pressure. She became not just competent, but excellent. Then came the emergency room, where chaos is routine, where decisions are immediate, where hesitation can cost lives. And again, she stood firm, focused, disciplined, ready. Today, in Michigan, she brings all of that experience with her. New York grit, surgical precision, emergency strength, and urgent care compassion. Every patient who walks through the door gets the best of her training and the best of her heart. She explains, she reassures, she acts, because behind every cough is a worried parent. Behind every chest pain is a scared family. Behind every breathing problem is someone praying it gets better. And Lindsey never forgets that. Heroes don't always stand on stages. They don't always wear capes. Sometimes they wear scrubs. They miss holidays. They work long shifts. They carry the weight of responsibility quietly, and they go home knowing they made a difference. From the Bronx to Michigan, from surgery rooms to urgent care hallways, from city lights to Midwest communities, Lindsey represents the best of American medicine: skill, resilience, compassion, strength. If she could survive New York, she could lead anywhere. And today, families across Michigan rest easier because when it mattered most, she was there. Some legends are loud, others build their legacy one patient at a time. Lindsey is one of them.